there a polygenic multifactorial basis of cardiovascular diseases?
Yes, of course. So majority of cardiovascular diseases, apart from very rare syndromes, all have multiple genes that interact with environment, and that's why it's been so difficult to discover all the causality, all the mechanisms, all the pathways.
So traditional medicine versus genetic medicine. What about the future?
Well, I think the future is what I call precision medicine rather than genetic medicine. As I tried to describe during my lecture, I think the molecular medicine requires not only DNA and the genome, but also what we call other omes. We use the name polyomics. So we are interested in mRNA, we are interested in proteins, we are interested in metabolome, and we are interested in epigenetics, epigenomics. And all this needs to be analyzed together to understand complexity of human pathology, because we humans and disease is much more complicated than just one gene. You know, there are rare diseases, rare inherited syndromes, where one gene describes and completely explains very high blood pressure, but these are very, very rare. So we need to be more sophisticated. So future is in precision medicine, where we do complex polyomics and try to substratify disease such as high blood pressure or heart failure into many substratas, and then have the right treatment for patients. So stratified precision medicine, personalized medicine, for me that is the future of medicine.
Could we translate discoveries into clinical useful application?
I think we can and we have to, because otherwise we fail our patients. So discoveries that are just published in Nature and not translated, I don't think are helpful. Not everything will be translated, but our job is to use all the best brains to translate what can be translated, however difficult and however long it might take. And I think that's what precision medicine is all about. Not everything will lead to new drug, but it might allow us to select the right drug for right patient at the right time and do it without any side effects. And I think in chronic diseases that last the lifetime, if you select the wrong drug at the beginning, hypertension is the best example, then the patient doesn't take the drug because he or she had a bad experience at the beginning. So I think by being cautious and selecting the right drug for right patient at the right time, we will help patients, countries, everybody, but also pharmaceutical industry, because you won't have this enormous wastage of drugs that are not used because the patient is non-adherent, non-compliant due to some bad experience.